call as to how you want to do this. Whether you want to snake
I've
it
never
underneath.
worn one of these.
Well, snake it underneath.
Behind underneath
No,
or front underneath?
Yeah, front underneath.
Yeah, I'm going to need to go to the ladies' room. Because then where does this attach?
That should go in your pants.
Somewhere over
clip
here.
on your pants.
Jules? Yeah. Let's go. We're gonna MacGyver this. Is it on? So if I make inappropriate comments in the bathroom, you're gonna hear it. Where's the best place to put it? Right there? Okay. I'm gonna retuck.
This is the best place to keep it out of the way because if you talk with your hands,
Yes, I do.
what happens is you knock it out of your pocket.
Oh.
Done that a few times.
Yeah, that's not good. Okay. Ooh, that's like kind of like a phantom hair feeling.
Woo! Which I absolutely despise, which is why I always. Now she's kind of going.
Now we're good?
Now we're dangerous.
I just need to light her up.
Not on fire. Just light me up. It's like Renee. Speed up, slow down. Well, Chris is traveling. Chris is traveling. Yeah. I am here. I mostly just drive. So I rarely get on a plane. I'll be on a plane next week. I'm going to go visit a hopefully soon-to-be client in LA. So, need to give her a little push. Santa Monica, Pacific Palisades. Yeah. Yeah, I'm going to go down and back in one day. So LAX, rent a car, and yeah. I was talking to a doctor who's in Los Cerritos down there, which is Orange County, but he stopped. He stopped responding. He was talking to Kevin Brookhart too, and then he came and sought out Hygiene Mastery at CDA South, gung ho, and then just like radio silence. Kevin and I both just got radio silence. So. Well, they did, what is it, JP Institute? They did JP Institute, and so he was like, how would that work? And I gave him all the information on it, and he brought his wife and one of his other hygienists to the booth with him. And we talked for like 30 minutes. They had a list of questions, and they gave me their information, and I said I would reach out, and we exchanged some conversation, and then it was like, so I don't know what happened. Yeah. Chris did, didn't you? You worked for them for a little while. Yeah. Did they have any asterisks on them or purple stickers anywhere? pretty. Those are gorgeous. Yeah, Zig. I like Zig.
Somebody said they'll be distracting.
Aw. All right. Yeah, I'll stare at him. That's cute. That's cute. Hi. Good. Go ahead and have a seat, and there's a CE sign-in going around. Yeah, and there's food, and yeah. You want to get up close and personal? You can sit up there. I said you can sit up there, get up close and personal.
We have 5 of us.
Oh.
So it's like,
There are 5 up front, or there's 5. Well, actually, you guys might need to split up or ask people. Yeah. What are we too young up for? Hello, welcome. Just find a seat. There's food and hi. How are you? Good. Welcome. There's a sign-in sheet going around somewhere. It will find its way to you. Who has the sign-in sheet? I just keep telling people yeah, that's what I'm like. Find a seat, grab some food. It'll find you. It will find you. You found it. These.
just wait till people sit.
Yeah. There you go. Just bring it in. You got to bring some greenery, some foliage. Foliage. Yes. Plus us. Yeah. Yeah, I'm going to borrow it just for a little chat. Yeah.
You could actually, I don't know, give it away if you had a reason, like a way to give it away. It would be fine.
Okay.
It would be fine. I have you down there.
What? Oh, those men. Those men.
He's worn jackets,
Uh-huh.
not a suit, so he wants to wear a suit.
To the wedding?
Decided. And the funeral.
Oh, okay, okay.
We decided at 3 o'clock today that we'd try on.
Of course. Of course. None of them fit.
Oh no, he was a lot bigger.
Oh, okay, good. Thank you. He's decreased. He's shrunk. He shrunk. That's awesome. Hi. How are you? Look at you. She goes and gets her healthy meal. Are those zoodles? Yeah. Digital doc isn't here. Kelly. Or just make sure that, I don't know. Nobody wants to sit up front with me. I don't spit. I don't smell. I do a little bit. Which one? Spit or smell? Okay. I'm cool with that then. Yeah. Oh. You don't have your straw though to catch it. My pump up song. There we go. So you're full back here. Jim's sitting next to you. This is full. So 1, 2, 3, 4, 5, 6. Still coming? It's okay. Awesome.
I didn't get the one that updated where you went to school.
Oh no.
It's okay. Another shared.
No.
Should've-
I thought
it
since we
should've
shared it, it would have updated. Yeah.
Yeah, that's what I would.
I'll just reshare it.
Hello.
How are you?
Hi.
Armando.
Nice to
Hi.
meet you. Yeah, we're signing right in, with the sign-in sheet. There is some food over in the corner. Please grab some food and get a seat up front, and we're ready to get started. There's a seat right here too. Wendy. Oh, he's right behind you. There you go. Oh, he was just passing by you. What? He was just passing by. I was just getting yours. You did exactly what he was standing behind you. I was just saying Wendy, and then he passed. So you did exactly. You opened the gate. Hi, come on in. You found us. Come on in. Yolanda Baker, nice to meet you. Come on in. There's also some seats right up here.
I just shared it again.
Perfect. See if that updates it. Let me go out of here. It's not a big deal. It's not. Let's see. Probably takes a little while for people.
Yeah.
You can just tell me which.
I went to USC.
Okay.
Yeah,
USC.
for my
That's
bachelor's and my master's.
perfect.
Mhm.
Okay.
It's weird
So
that
I
it
think
didn't
that
update.
was 2 people and there was 3, so I think we should just start.
Okay.
And I'm not Mike, so just stand near me.
You want to speak into my chest.
I'll just speak close to you.
I'll just do this into the chest.
Hello. Who's had an exciting day of dentistry today? Yay! Who's enjoying the food?
Smells really
Yes?
good.
Yes?
Yes.
Good. There's going to be plenty of water, and then I have like kind of on a mid-break time. We have some cookies, so there will be more sugar besides the little Hershey kisses up in front of you. Thanks for coming out this evening and joining us. We have a very, very exciting night. We have 2 in the room lovely ladies who have an immense amount of experience and really running incredible hygiene departments. You can see by the bags, it actually says Hygiene Mastery. Can you shut the door? Yeah. Hygiene Mastery. Hygiene Mastery is just as it says. It's about ever going, or constant and never-ending improvement. It's about continuing to work on that skill. There's no coincidence that we call, dental as a practice. We are a practice, always learning. So I want to acknowledge all of you for coming out and continuing that learning tonight to get a few pearls for your patients and to make a better life for them and to really make a difference. And so tonight I want to introduce real quick for us, and she's going to get right into all the meat of tonight's material.
Yes.
This is Julia Dent, Miss Julia Dent. If you can help me to welcome her with a great smile.
Thank you.
And lots of clapter. We do have some people joining us live broadcast. I wanted to acknowledge that some people are sitting in the comfort of their homes, but they're missing out on the wonderful food, and so you guys are going to be able to get the first questions answered and be able to support us. If we see anything live, we might say that we have a question from a live audience member, so we'll bring
Exciting,
that in.
yeah.
So very exciting. A little bit about the room that you're in. We have ongoing continuing education courses in both practice mastery and also in clinical mastery. In fact, tomorrow, super exciting, she's going to be coming up with another course tomorrow in hygiene mastery with lasers.
Yes.
So there's going to be some interesting and exciting things going on in this room tomorrow. I'm sure lots of laughter.
Yes.
So, and then also there's courses coming up that are involved with leadership. We have some facial aesthetics. We have some things in plasma-rich protein coming up. We're going to be looking at some probiotics. And on the survey that you'll fill out tonight, if there's anything that you would like to know, we would like to know, because we could be able to find a speaker to bring that education to you. I'm very much on the interest of looking for someone who would be able to talk about marijuana a little bit. Now that it's legal, now that we're in there, we're figuring it out and finding that. I feel like there's a lot for us to figure out and know about that as professionals. So I am on a search for someone. So if someone knows someone, that would be great. So I am Dr. Yolanda Mangrum, and I'm the owner of Luminary Education Center here. And I want to introduce my partner here too, Kelly Guns. She's also one of my partners in another business. We have Fortune Management, and Fortune Management has sponsored Hygiene Mastery to come out tonight. And so if you had any questions about getting that extraordinary practice and having that extraordinary life, Kelly is right here for you guys. So now to introduce Julia Dent. We have been sending words out to the universe, looking for Julia to come into Northern California. And there's been a lot of intention being sent out all across the nation, actually, to find Julia. So it's been years in the awaiting for us to find her. She's got her master's from USC, and she's got raving fans all over because we are so excited to have her here and to share these wonderful pillars that you're about to find out about. And then she can also talk to you about a little bit more when we take breaks. We also have Chris in the back here. She's also from Hygiene Mastery.
Yay!
And I want to also introduce Jim in the back. He's also from Fortune Management. And we have a crew in the back there that is keeping everything live, everything exciting and streaming. And so in the future, this might be something that you may want to consider with some of our courses as well, is to do some live streams. So tonight, we're very excited for our first night, and we're very excited for Julia.
Thank you. Thank you so much for that beautiful introduction, and thank you for inviting us into this beautiful space. I'm very Excited to be here with you guys. Like Yolanda said, we're going to cover a lot of really great information. And I want to first and foremost say I am not a talking head. I am here to interact with you. So why don't you guys raise your hand? Who is a hygienist in the room? Yeah. And who are my doctors in the room? Nice. And do I have assistants, front desk administrators? Awesome. Welcome. So we've got a nice mix in here. This is great. So before we can really talk about increasing the hygienist role in case acceptance, we first have to really think about what the dental hygiene department is. So I'm sure you've all have been working today, so let's start out with a little bit of an exercise. So you are a part of this. This is not a rhetorical question. So tell me, the hygiene department, do we render services? Yes. So does that mean we create production? Yes. What are some of the services we render? Cleanings. What else? Yes. Awesome. Anything else? Say that again? Fluoride, yeah. Awesome. So that's our production, right? That's money coming in. And is it safe to say that there's a cost to running your hygiene department? Yes. What are some of our costs? Materials, disposables, what else? Instruments. Salary. That's our biggest one, let's be honest. So we have money coming in and we have money going out. So what does this equal? This equals a business. So we are a business within a business. Okay? I'm going to call out that we will be talking about money tonight. And sometimes that can feel a little uncomfortable because we all went into this to save the world with floss. Yes? We did. We thought we were going to come out and we were going to save the world with floss. So I want to call that out because we truly are a business within the business, and we're the lifeblood of the business. Our patients spend 80% of their time with us. We're the reason they come back, right? They see us every 6 months, every 3 months, every 4 months. So we really are the lifeblood of the practice. And most businesses, or at least the great businesses, have a business model. Yes or yes? Yes. And so is it safe to say that the hygiene department should probably have a business model? Right? Oftentimes we don't. And that can lead to a lot of frustration and a lot of miscommunication. So at Hygiene Mastery, we fully believe that you guys should have a business model so that you're successful. And Hygiene Mastery has a business model. And so you guys all have handouts. You have the House of Hygiene on that very first page. And I'm going to talk to you a little bit about this business model. So our House of Hygiene is built on a foundation, and then we have 8 pillars. And the stronger each pillar is, the more unstoppable your hygiene department will be. Now, each of these pillars could be a 6-hour workshop on their own. So I am going to touch on a few of them. We are going to talk about co-discovery. We're going to talk about technology. We're going to talk about how to be master communicators. But in order to have a strong business, we have to have a strong foundation. So foundation is built on the practice vision. If you don't have a practice vision, I highly recommend getting with a fortune coach and creating one. If you do have a practice vision, I highly recommend that you memorize it and hold it near and dear to your heart. Okay? So after we're clear on what our practice vision is, then we have the hygiene standard of care or the hygiene department vision. Now this should be built upon your practice vision and it should be congruent with that so that we're all working towards the same goal. Okay? And then we have personal and professional development, which is what I want to honor and acknowledge all of you for because you're here. I know you probably had long days and you're here with smiles on your faces and you're engaging tonight. So I definitely want to honor you guys for that. You're already a part of this foundation. And then co-discovery really means that we are working together to do a really thorough assessment for our patients in order to have a great conversation with our doctor about what our patient needs and deserves. Disease prevention, that's going to be OHI. Periodontal therapy speaks for itself. Internal marketing, you, my hygienists, are in the perfect position to be a cheerleader for your practice. Like I said, your patients spend 80% of their time with you. Technology, intraoral camera, lasers like we're going to do tomorrow, ultrasonics. Technology can be a lot of different things. It can be a CBCT, all these things that are going on in the practice and how you utilize them. I will say my favorite technology is the intraoral camera. You guys have a beautiful handout from Digital Doc, and we're going to see some of the gorgeous photos that those intraoral cameras can take. Advocacy, we advocate for our patients, and sometimes we advocate to our patients, what they really deserve. Master communicator, we're going to go over a few tips on really how to be communicating with our patients in a way that serves them best. And this also pours over into how we communicate with those in our office. And then lastly, a business leader. Like we said, we're a business within the business, and so we really want to be leading that charge, and we want to be leading our business. Okay, so just to touch on a few examples in each of those. Like I said, these are normally like 6-hour workshops all in themselves. So you guys are going to get the hot tips, the real highlights tonight, okay? And then Hygiene Mastery, we have 6 core values. And that first core value is our most important. And what it is that we believe in delivering extraordinary patient care. We always act in the very best interest of our patient, okay? Second, we believe at arresting oral disease at the earliest juncture. Why are we waiting? We're waiting, we're watching, and it's getting ruined, okay? Number 3, we believe that the patient benefits when the hygienist and the doctor are in a co-discovery relationship, and we're going to go into that one a little bit more tonight. We believe in using every tool possible to treat oral disease. Laser, antibiotics, intraoral cameras, ultrasonics, really taking a tailored approach to our patient care. We believe financial considerations should not prohibit what the patient needs. And then lastly, we believe that the hygiene department plays a vital role in practice growth and the health of the patient. Okay? What the hygiene department truly is and what we believe, let's dive right in. That's why you're here, right? So we're going to go over, there are going to be 5 essential tips that we're going to go over tonight, starting with systemic health. Okay? Your most successful hygienists will link the mouth back to the body. Our patients believe our mouth is floating out here and that it does not affect our body at all, right? How many times have you done a medical history review and you ask them what medications have changed, have you been hospitalized, anything like that, and the response you get back is, oh, I had something and that really doesn't affect my mouth. I had surgery, that really doesn't affect my mouth. I was hospitalized for 2 weeks, that really doesn't affect my mouth. The more times you link their health back to their mouth, are they a diabetic? Let's talk about poor wound healing. Gingivitis is a wound. Are they on high blood pressure medication? Are they on multiple medications? We all know what that does to their mouth. We know that the plaque in the body is a plaque that ends up in their heart. It's a plaque that ends up in their veins, their arteries. Poor oral health puts them at 2 times higher to have a heart attack and 3 times higher to have a stroke. They need to know that. They need to know that the neglect in their mouth is affecting the rest of their body. And by doing that, I'm going to use this word, you can sell dentistry. And when I say sell, that means you can get the patient to accept the care they need and deserve. Okay? So the more times that you can link this back to, more times you can link the mouth back to the body, the more successful you'll be when you start talking about the disease that's going on in their mouth. They're going to understand that it's not just sitting out here out in no man's land, but it's truly a part of the rest of their body. Okay? Number 2, what patients want. These are 4 patient motivators. So this is typically where your patients are going to come from when you're talking to them about care. And it would be great if Susie walked in and she said, hey Julia, you know, what really motivates me is comfort. But Susie doesn't say that. Susie doesn't walk in and tell me what motivates her. However, you can find out from your patient what motivates them by listening to the verb or the verbiage that they're using. You'll hear them when you start to talk about a filling or the need for a crown. You'll hear them saying, I don't want to be in pain. I don't want to be in pain. I had a patient who, he was such a funny guy. He came in every 4 months because he didn't want to be in pain. And I kid you not, you guys, from the minute he sat down in the chair, every sentence after whatever question he answered was, and no pain. So I would go to take blood pressure on his wrist. And I would say, okay, we're going to take blood pressure. And it was the wrist cuff, so it came across his arm like this. And he'd go, okay, and no pain. I was like, yes, Nicholas, no pain. So obviously, comfort is a really big motivator for him. He lost a tooth on the lower right-hand side, and we were going to do an implant. So my conversation with Nicholas was very much, we've lost this tooth. I don't want you to be in pain. I don't want these other teeth to be affected by the tooth that you've already lost. We need to do an implant sooner rather than later so that you don't experience any more pain. That connects for him. He understands that I've got his best interest at heart and that I'm really looking at what motivates him and how to get him the care that he needs and deserves. Does that make sense? Yeah? Okay, great. Function, these are your patients who are going to tell you that they want to eat their teeth they want to eat their food for the rest of their life. They don't want to eat their teeth. They want to eat their food for the rest of their life. They just want their teeth to work. Cosmetic, these are your patients who the whitening conversation is always going to come up. When you talk to them about getting a crown or a filling done, they're going to ask for the white crown or the white filling. They want to make sure that their smile looks great. These are also your patients who you'll notice come in like dressed to the nines. Like everything's perfect. Beautiful hair, they got their makeup done, their outfit looks good. That's important to them. And then longevity, those are your patients who are most likely going to say, I just want to keep my teeth for the rest of my life. I don't really care what they look like, or I don't really need that. I just want to keep them for the rest of my life. They don't always understand that they need to do more of the preventative dentistry in order to achieve that. So you want to be listening to the words they use, and you want to use those words back to them. Okay? Of these 4 patient motivators, which one do you guys think is the one that comes up the most? Cosmetic. Because you're hearing whitening a lot, or what are you hearing in your practices that makes you think that? I don't have a statistic on this. This is just a question. Whitening? Nice aligned teeth. So do you do Invisalign in your practice? Okay. So do you talk to them about that?
Yes, but it's just like motivation is like so expensive. And
Mm-hmm.
you wanted to know how much it's costing.
Mm-hmm. So be sure to tell them that those nice white teeth are going to look even better when they're straight. Number 3, hygienist and doctor co-discovery relationship. Tell me why you think this is important.
Seem like a team
Mm-hmm.
on the same side.
Yes. What else? That was a good one.
For the patient to understand everything a lot better because it's getting verbalized by 2 different people into the same information.
Mm-hmm. And making it congruent. Okay, great. What else?
Sometimes 2 eyes are better. 2 sets of eyes are better than 1 eye may see something they may. So that's
Yes. Yeah.
touch things.
Yeah.
I feel like if you're not on the same page, it negates somebody's credibility. The patient
Mm.
questioning,
That is a great point.
like then they're confused.
Mm-hmm.
So if you're not on the same team and not looking for the same things, then you're just hurting them in the end.
And how often we're the one that's wrong, right?
As the doctor says it, it goes.
Just repeat when someone's saying something, a question.
Oh, okay.
Yeah, so everybody can, so the people,
Got it.
everybody can hear.
Got it. So she was saying that that you want to be congruent so that somebody isn't wrong, right? Because most of the time you will find that if you're going the route of the crown and then your doctor comes in and says, oh no, we don't need to do anything, the person that never wants to do anything is right. Do you get that? Because it doesn't cost anything, which means that there isn't an actual problem or there isn't an actual reason to do the work. Okay. What else? You guys hit him. That was great.
From my perspective, I would want to see that people own their problems.
Yeah, people owning their disease.
Or have to do something about it, or at least find out more information. And so things like photos, for instance, or if you see a photo you can blow up on a monitor screen,
Yes.
shows cracked tooth or shows gum recession behind the upper front teeth, or shows a wall of calculus or whatever. They sort of own people. My experience is that people that have periodontal disease, you just as soon drop it off at 9 and pick it up at 5. They don't really want to be involved with the thing unless they kind of see it, unless they, maybe they smell it.
Yes.
Runs some floss around the teeth, say, how does that smell?
Yeah.
Right?
Or, how often does periodontal disease hurt? Not until it's too late. Not until those teeth are flapping in the wind and all of a sudden they really can't chew anymore. Yeah. That's a great point. So, predictable treatment enrollment, you guys touched on that. 2 eyes are better than 1, saying the same thing. Congruency between your hygiene team, this is huge. The more you guys are all saying the same thing, so if they see me or if they saw Cindy and I are saying the same thing. We're both telling the patient what they need. And that happens because we're working with our doctor, and so we all end up having similar conversations. Your handoffs become more efficient and effective, and then you have a healthier practice because you have healthier patients. And I really want you guys to know that most importantly, doing these things takes you from a mouth maid to an oral healthcare professional, which is what you are. And patients don't always understand that. And so by working on a co-discovery relationship with your doctor, that elevates who you are in the practice. And our profession's changing. And in today's dentistry, your influence and your treatment recommendations are huge. Patients are starting to listen to that. And without you, your doctor has to take a lot more time and energy. And of course, then we get upset because you're making me run late. We all know that. So if you can be doing these things beforehand, it's going to make everything that much easier. So your handoffs are going to become more accurate. They're going to become faster. And then because you're increasing this case acceptance, your patients are saying more yes. You're going to have a healthier practice because your patients are healthier. Okay? Being in a co-discovery relationship with your doctor does not happen overnight. You don't walk in your first day and everything goes planned and everything is just smooth sailing from the get-go. It can be a little bumpy. And so in your packet, we have outlined the 7 steps of the hygiene assessment. These 7 steps allow you to collect a lot of information in a short amount of time. Okay, so that first step, WMI. Who can tell me what WMI stands for?
What's most important?
Yes! So WMI stands for what's most important.
Their chief complaint?
Great point. Their chief complaint is actually different from what's most important. What the chief complaint tells the patient is that it's not important unless it hurts. Because typically they're coming in with a chief complaint. This tooth hurts. This tooth is sharp. This tooth has a dull ache. This tooth, it looks like it has a crack. So they're calling out what they see as a problem. And if it's a problem, you fix it. But if it's not a problem, you don't need to fix it. So there is a distinction between what's most important and the chief complaint. Does that make sense? Yeah? Did everybody else understand that? Okay, great. So Let's talk about why you ask this question. We talked about those 4 patient motivators, right? And I said you should be listening to the verbiage that they're using. This question is going to help you get to that patient motivator so much faster, okay? So by asking them what's most important to you, they are going to automatically unveil their patient motivator, and they're going to give you their rules and values around that patient motivator, okay? So if you think back to patient motivators, cosmetic, for some people it may be bright white Hollywood chiclet smile. For others, it could be, I chipped number 9, I just need you to slap a little bonding on it, you know? And that's cosmetic for them. They just want all their teeth to be the same length. So by asking what's most important to your patient, that's going to help you unveil those things. So that's why we're asking it. Let's talk about how to ask it. Because let me tell you right now, this is a little bit awkward. First few times you ask your patient what's most important to them, it will be awkward. I'm calling that out now, so when you're sitting there and you're like, oh my God, she told me to ask this, and now they're like not responding, it's okay. And it's okay because no one is asking them this. When was the last time you went to your physician and they said, hey, what's most important to you today during your physical? They're not asking it. No one's asking this. So there are 3 different ways that you can ask this that will help get to what you want from your patient. And the first way you want to ask it is, what's most important to you in your dental health? Okay? That's probably the easiest one for my hygienist because you're going to be asking it chairside. You can ask, what's most important to you in your appointment today? And my hygienist, if you're asking that chairside, ask them, what's most important to you during your cleaning appointment today? Because if you just ask what's most important to you in your appointment or during your appointment, they're going to look at you and they're going to go, I'm here for my cleaning, right? Just my cleaning. So by adding cleaning, we're cutting that off. We're trying to go a little bit deeper with them because we're trying to figure out what motivates them. So we can ask, what's most important to you in your dental health? What's most important to you during your appointment today? Or this is great for my administrators. What's most important to you when you visit our office? Okay. And this is a question that isn't just chairside. You can ask this at multiple times at multiple points throughout the office. Okay? And then you want to put this somewhere in your software or somewhere in your paper chart, whatever you're using. You want to put it in a universal space so that everyone can access it at any time. Because once you ask this, you want to be able to ask it again the next time and do like a check-in. So if I said, what's most important to me is that I want to keep my teeth for the rest of my life, that translates to longevity as my patient motivator. And then when you see me in 6 months or whatever recare I'm on, you want to ask me, Julia, last time we spoke, you told me what was most important to you is you want to keep your teeth for the rest of your life. Is that still what's most important to you? Most likely it won't change, but it can. And so we want to be checking in. This makes your patients feel incredibly cared for, and it helps you get into instant rapport with them. And when you're in instant rapport with your patients, then you can talk to them about almost anything, and they understand that you're coming from a place of sincerity and that you're really trying to get them to the care they need and deserve. Okay? Questions about WMI? This is a powerful question, you guys. You'll be amazed at the answers you get. And you may have been seeing some of these patients for like 10 plus years, and you assume you know what it is, and the answer you get is going to blow you away. I'm excited. I'm excited for you guys to use this one. At this point, I'm going to call out, so there are 7 steps here. These are set up in the most efficient way, okay? And I'm going to tell you why. The first 4, your patient is sitting up. Halfway through 4, your patient's going to lay down. So instead of stand up, sit down, fight, 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 you can just do it in this order, and it's much more efficient. We already talked about medical history update. And again, I just want to call out how powerful it is to do a thorough medical history for your patient, you guys need to know that your patients still believe dentistry is an elective service. Let that sink in. They think it's elective. They don't understand that it's a health service. And it's our job to help them understand that, okay? Radiographs, put a system in place, decide what you want your standard of care to be with radiographs. Oral cancer screening, I could do an entire evening on this. So if you want any information on oral cancer, please come and talk to me afterwards. You guys all have my phone number and my email address in that folder you got. I'll talk your ear off on oral cancer. I really believe in oral cancer screenings, and so, like I said, that could be a whole nother evening. But again, talk amongst your other hygienists and decide what your standard of care is regarding this. I will tell you that one person dies every hour in the United States from oral cancer. And if we're not talking about it, no one is. Okay? This is our cancer. We need to own that, and we need to make patients aware of it. Dentition and occlusion, this is where you're going to talk to your patients about those crooked lower anteriors. This is where you're going to assess their bite. Are they in class 1? Where are they at? This is where you're going to start to look at, are fillings breaking down? What disease process is happening with those fillings, with those crowns? Number 6, I told you this is my favorite piece of technology. Intraoral camera, intraoral camera, intraoral camera. If you don't have one, we need to figure out how to get you one. Okay? We have some beautiful slides that we're going to do here in a few minutes. Digital Doc provided us with gorgeous photos. This intraoral camera is amazing. I do not have one in my office. I wish I did. But the level of detail that you can get with this is amazing. And we're going to talk about how to elegantly enroll our patients with our intraoral camera. I typically recommend that you take at least one photo on every patient if you can. I would tell you that the money shot is their lower anteriors. For my hygienists, do a before and after. Tell them why your hand hurts. Talk to them about why they need to come in more often. Also, it helps them own their disease, right? And if they understand why they have this disease and that it's their disease, then again, we're talking about how to enroll them into the periotherapy that they need and deserve, right? And that's how our enrollment goes up. And then lastly, periodontal charting. I highly recommend, at the very least, every patient has pocket depths, recession, and bleeding. The very least, okay? So if you're not doing that, I would highly recommend that you decide that that's your new standard of care, and moving forward, that's what you're going to do. Okay. Questions on our 7-step, little tongue-tied there. 7-step assessment process. No? Is anybody doing this already? I know some of you are. Awesome. Awesome. Be sure to call out to your patients when you're doing these things. Okay? Because again, you're not a mouth maid. You're an oral healthcare professional. And they need to know that. They need to recognize you in that light because, again, that's going to help increase your case acceptance and help you enroll your patients in the care they need and deserve. Okay? So let's talk about that intraoral camera. So elegant influence with the intraoral camera. As hygienists, we are typically really great at 2 out of 4. Okay? We're great at identifying that need. You have a broken tooth. You need to align your teeth. You have periodontal disease. We're great at calling that out. So we rock at identifying your need. We're also really great at stating the consequences. So you have a broken tooth. You need to get a filling done, or you need to put a crown on that tooth, or you have periodontal disease. You need to have periotherapy. If you don't get the periotherapy done, more long term, you are going to lose some teeth. Okay? We're great at these first 2 steps. We're getting better at being the solution. We're leading them there. We're talking to them. We're saying, you need that crown. You need that scaling and root planing. You need that filling. Being that solution. we hardly ever get the commitment. So we may take them through 3 of these steps, and we've done a beautiful job, and then we just stop. So we don't say, Susie, you have a cracked tooth. I'm concerned that it's going to break. We should definitely do a filling or a crown. Dr. B will let you know what he thinks is going to be better for you. The end. We need to be really great about taking it to that next step. Once Dr. B lets you know what you need, he has an appointment on Friday that we can put you in for. I'm really concerned we need to do this sooner rather than later. What questions do you have? What questions do you have about that crown? What questions do you have about that filling? What questions do you have about coming in on Friday? Okay? It's a power question. What questions do you have? It's open-ended. It's not a yes or no question. More often than not, if you ask your patient a yes or no question, do you know what the immediate answer will be? It's no, every time. I could die of thirst because if you ask me if I want a cup of water, I'm going to say no. We do not want to inconvenience people. So when we phrase a question as yes or no, the answer is always no. Okay? So be thinking about ways that you can phrase things so that they're open-ended, because that keeps the conversation going. What questions do you have for me? What questions can I answer for you? What questions do you have about that crown? What questions do you have about that filling? What questions do you have about that periotherapy? Okay? So, this is a photo from Digital Doc. Wow. Right? Wow, I love that response. If you put this up in front of me, I'm going to tell you my treatment plan, right? If that's on the computer screen that's facing me, if I'm a cosmetic person and you put that up in front of me, holy cow, I need that out of my mouth as soon as possible. I need all my fillings to be bright white. Is that corroding? Okay. So even if you are working on your elegant influence and you're not quite great at all 4 steps, a picture speaks 1,000 words, okay? So if you put this up in front of your patient, they're going to ask questions, even if you say nothing about it. I just love that photo. Some of your patients will say, ew, gross, I don't want to see that. But 65% of our patients are visual. So if they don't have a picture, they're not connecting that disease process. They're not connecting that my tooth is cracked, that it is corroding, that if I can get my instrument probably at the top and around here, bacteria can get in there. Okay? So putting that picture up really allows them to understand what it is you're recommending. I highly recommend, because we're mostly hygienists in here, we don't share. I highly recommend that there's an intraoral camera in each operatory. Or there's enough that maybe it's shared between 2. And I'll be honest, when I work, I share one intraoral camera with, there are 3 of us typically when we're working. I share one. They know that if they can't find the intraoral camera, it's in my room. It's always in my room. Because I can't live without it. I really can't. And my patients say yes more often because I'm showing them what I'm seeing. Okay, and I'm taking them through that process. So, elegant influence of the intraoral camera, and because I told you, intraoral camera, intraoral camera, intraoral camera, I'm going to make you guys role play this. You don't have to role play it up here with me, but I am going to make you role play this with a buddy, okay? So for me, if I was going to talk to a patient about this, I would identify the need, right? I would say, oh, Susie, this tooth I'm really concerned about. I can see a crack. I can see that the filling is pulling away from the tooth. I'm going to state the consequences. If we don't do this sooner rather than later, I'm really concerned that this tooth is going to break because I can tell that that grayness underneath on your right hand side and that crack line, this tooth is breaking down. The good news is that we can put a crown on this tooth, we can reinforce this tooth, and we can save this tooth. Dr. B is going to come up. He's just going to confirm that that's what we need to do. And then we should probably get this done in the next 2 to 4 weeks. What questions do you have for me? And they may say, I've never had a crown. What does that entail? If you're a CEREC doctor, you get to say, you know what, we can do this in a day. We don't have to wait anymore. If it's a 2-step appointment, then you walk them through that. What else? What other questions do you have? Wouldn't it make sense that we get that done sooner rather than later? Yeah. Yes. Dr. Hodge?
It's me again.
It's you again, Dr. Hodge.
So what would it be like if you said to the patient, instead of starting to tell them whatever, what if you said, tell me what you see?
Oh, yeah.
And let them tell you. They may already know what the treatment is. Maybe they've already been through this 3 times.
Definitely.
So if it's
I've had, yeah.
looks to me like it's cracked and stuff, I don't know. I see other little cracks over there on that other right side.
All those little mini cracks.
Crumbling. I guess I need another crown.
Great word.
Just confirm it,
Yes,
right?
absolutely.
That's pretty easy.
Definitely.
He says, I don't see much. If you point out that crack on the left-hand side of the screen, bacteria went 25,000th of an inch. They can mark this through there as big as like a pump load.
Oh, yeah. Yes.
So maybe that's one somebody says, geez, I think we better fix that, or I don't want a toothache, or whatever.
And don't be afraid to put the patient in pain, truthfully. What if we don't put a crown on this, you guys? Say it louder. It's going to break. If it breaks, do we know if it's going to break off a little piece? Do we know if it's going to break off below the gum line? Do we know if the entire filling's going to fall out? No, we don't have a magic 8 ball. So it's okay to put them in pain. The good news is we can put a crown on it now. If we wait, this is for your comfort patient. If we wait, I know that it's going to break and you're going to be really uncomfortable. And I know that it's going to break on Christmas Eve while you're cooking the roast at the most inconvenient time, and you're not going to be able to get in for a week. And I know you're going on vacation January 1st, so while you're in the Bahamas, you're going to have this gaping hole in your mouth. Let's do the crown now. Let's do it sooner rather than later. It's okay to put them in a little bit of pain. It's okay to take them there. What if they need the implant? We all know if it breaks below the gum line, more often than not, they're going to need an implant. You can't always save that tooth. Now we just went from anywhere from $1,400 to $1,700 crown to $5,000 to $6,000. Remember, we believe at arresting decay or arresting oral disease at the earliest possible juncture. Okay? It's okay to be aggressive with disease. Not talking about the things that they don't need, but definitely doing that assessment to find out what they do need. And helping them work it into what's going to work for their budget, what's going to work for their timeline, what's going to work for their life. Okay? We can also elegantly enroll in periodontal therapy, and you can use your intraoral camera for this. One of my other favorite things to do is, if you're handy, or if you have someone in the office who can help you, if you have an assistant, calling them over, asking them to help with the intraoral camera, put the probe in there. Show them a healthy area, how it's not bleeding, and then go to that diseased area, 4 5 millimeter pockets, and show them how deep the probe goes and show them the blood. They get a little more squeamish with that one. They're typically okay with these type of photos. But suddenly that conversation goes from being so abstract, we got the pocket and this is what this means, to all of a sudden they're connecting the dots in their own mouth. Okay? Okay, so I want you to find a partner, turn to whoever, side to side, front to back. This tooth. I want you to take this tooth. This is in your mouth or in your patient's mouth, and I want you to elegantly enroll your patient in what they need. Okay? So we'll do this for a few minutes, and then we will take like a 10-minute break. Okay. Gotta keep you guys awake. We gotta do an activity.
I don't want to say too many things, and I don't want to interrupt your.
It's okay.
It's okay.
It's good. Yes.
I have lots
Ask
of
questions.
things to say. I have other ways of
No, it's good. It's prompting the conversation. I'm going really fast. I have extra slides built in, but I've noticed I'm going really fast because I still have an hour and a half.
Oh, that's okay. Are you about halfway
Ask
through
questions.
your slides or more?
I'm probably a little more than halfway through.
Okay. Well,
Yeah.
we've got lots to fill it in.
Okay. Yeah.
Thanks. We're gonna have some. We're getting a mic run so people can do a ask the experts kind of
Okay, cool.
that way, and then Kelly and we can have Chris and everyone come on up, and then we can do a whole ask the experts, and we can pass the mic.
Awesome.
That way they can say ask us anything right here.
Okay, good.
So you
I
don't
like
have to
that.
worry about that.
Good, good, good. Shannon and I built in extra slides, so if I need it, I can. Yeah. Yeah. Absolutely. Awesome.
Test, test, test. Test, test, test.
high-performing teams with Ty, and he is a certified Stephen Covey leadership facilitator, and that's coming up on the 28th. If anybody would like a flyer on that, we have that. This weekend, we're doing Certified CEREC Assistant program. It's a 3-course continuum over 3 months, and basically starts dental assistants from 0 to certified, being able to do CERECs in an hour. And we also have tomorrow's laser course, Hygiene Mastery, with. And so as we're going along, if you have a question, we do now have a mic so that we can hear, everyone from in the audience can hear. And so I will get this over to you. So just raise your hand, and I'll give you a mic to ask your question.
How'd it go? This isn't hard, but it takes practice, right? Because you have to think, we are elegantly influencing our patients. So the more you practice this, the better you become. You're able to fit in what motivates your patient. You want to bring everything back to what's most important to your patient. And by using your intraoral camera and elegantly influencing them, it's a real seamless, beautiful dance that you start doing with your doctor. And again, patients start to say yes. You get a lot of yeses out of your chair. They understand that we really have their best interest at heart. Okay? So did everybody say crown? Or did we backpedal? Did we go to some fillings? Because think about, too, this patient's really high risk. You can kind of tell, does my laser pointer work on this? No. You can kind of, and I'm short, but since they're already missing that tooth back there, they're high risk. So again, you want to put them in a little bit of pain. We already lost one tooth. So we want to be proactive with this one. Here's another beautiful photo. This would be a sealant for me personally. Now, I don't have a radiograph to back it up, but again, going to your patient for comfort, for your patient for longevity, you can talk to your patient about both those things in this photo, right? Longevity, let's put a sealant on this tooth. We know that if we don't have to drill on a tooth, the better off the tooth is, right? So really being proactive. Using this to enroll them in fluoride. You know, we're starting to see some staining in some areas. I'm getting concerned that we might have the start of a cavity here. Let's talk about what we're doing with fluoride for you. What's a fluoride program with the patient? I want to do a fluoride varnish on you at the end of each of your cleaning appointments with me. I want to talk about what toothpaste you're using at home. What are your take-homes? So all of those things you could talk about with this photo, okay? So number 5. Did I skip 4? No, this is number 5. Yes. Yes. Do you want me to come close so you can talk into my mic? Okay. He's teasing. Sorry, go ahead.
I'll try and talk loud. I think it's important to remember to also show patients good things.
Oh, yes. Thank you for saying that.
Otherwise, it's like, oh no, the camera.
Yes, oh, she's bringing the camera out. How much is this going to cost me? Yeah, no, that's an excellent point. And that goes back to, we talked about those pillars in the beginning. Internal marketing. Look at this beautiful crown that doctor did for you last week, right? Show off that work. They have no idea what a beautiful crown is, you know? I am the daughter of a lab tech, so anytime my patients have gold fillings, I get really excited and I tend to take a lot of photos. So they can see what beautiful work they have in there. That's important. They need to know that. And then that's also a way for you to promote your doctor. Look at the beautiful work Dr. B did. And then you get to start asking, like, who in your family comes here? Who else do you think deserves to be treated this well? We'd love to see your friends and your family asking for those referrals, okay? The more patients you have, the more patients you get to touch, and the healthier your patients are, which is what we're about. So number 5, what gets monitored gets results. Yes or yes, right? What gets monitored and reported gets results exponentially, and what gets monitored, reported, and acknowledged gets results exponentially and over again. So we highly recommend that you have some way of monitoring case acceptance. And case acceptance means that the patient's scheduled that day. So if you enrolled the patient in periotherapy, they got scheduled before they left. Same with a crown, filling, sealant. Okay? We want to know what that number is. We want to know where we're starting from. Because if we don't know where we're starting from, we don't know where we're going, right? We want to know, are we 90% effective? Are we rock stars at this? And if we are rock stars at this, let's celebrate. We want to know if we're at 20%. What's going on? Where's the disconnect? Is it between me and my doctor? Is it between me and my other hygienist? Is it between me and my front desk? Let's start figuring that out. Let's look at our communication tools. Our peak performing teams are typically 75 to 85, right in that range. So you don't want to be below 50, truthfully. So you need to figure out a way that you're going to track and monitor this. Because again, this gives you a roadmap. This gives you an idea of where you can go, or it gives you an idea, like I said, you may be awesome. So we want to be looking at these KPIs, these key performance indicators, so that we know what we're doing and where we're going. Okay? We work with cloud-based monitors. We work with Dental Intel, Square, Sika. Your fortune coaches have beautiful Excel spreadsheets that they can get with you and work on with you. But you need to monitor. If you're going to put in all this work on increasing case acceptance, you need a way to track that. Okay? And again, how awesome is it if you start tracking this and you get to celebrate? We don't often get to celebrate. A lot of times we're always like, oh, we need to work harder on this, or oh, we got to drive this. But if we're doing great at something, let's celebrate that, right? So those are the 5 tips for increasing case acceptance coming out of the hygiene chair. I also have a few pearls. I love that Yolanda used that word in the beginning. We didn't even plan that. I also have a few pearls that were kind of sprinkled in through here that I really want to call your attention to. So let's take a trip around this hygiene department. We talked a lot about transformational vocabulary without actually calling it transformational vocabulary. Okay? So we want to talk about if the patient is really concerned about cost, we want to talk about the investment that they're making in their mouth, and we want to honor that investment. That's an easier word for them to digest. Also in transformational vocabulary, that's where, well, actually it's at the end, your power questions. These two very much connect. We talked about your power questions. We asked, what changes have you had to your health history? What questions do you have for me? What's most important to you? These are power questions. And your power question is that open-ended question so that your patient can't just say no. So once they say no, it's hard to overcome that no. It very much feels like that conversation gets shut down immediately. And we want to leave it open because we want to have a dialogue with them. So transformational vocabulary and power questions help you build rapport. Those questions help you build rapport very quickly. And once you're in rapport with your patient, you can really start to talk about what motivates them. And they're going to look to you for your recommendations. They're going to want to know what you think. They're going to want to know why you think that. They begin to trust you. And if you are in rapport with your patient and you know what motivates them, what do you think is possible? A lot. Anything. Your patients don't often know what's possible in dentistry. They don't. So if you can get them into possibility, that's really exciting. They have no idea that they can afford the ortho. They have no idea that whitening is okay. How often do you get that question? Well, I want to whiten, but it's just going to destroy my teeth. It's so bad for me. No, let's talk about possibility. This is an exciting conversation to have. So when you are in rapport with them, you're in this land of possibility. And And that's an exciting place to be in dentistry. IOC. What does that stand for? One more time. And last time. Thank you. And then we want to be able to identify obstacles with our patients. Every time a patient comes up with an excuse, they're putting up a wall, we want to be able to break down that wall, and we want to be able to tackle those obstacles with them. And we do that by asking power questions, by being in rapport with them, by using our intraoral camera, by using transformational vocabulary. So those were a few of our little pearls that were sprinkled into our 5 tips for increasing case acceptance. Now, I've given you guys a lot of information, and sometimes it's hard to connect these dots, or sometimes it's hard to know, how does this fit in? Because what's the 4-letter word that every hygienist knows? I'll give you a hint. Starts with a T, ends with I'm. Thank you. Time. It's a 4-letter word we all know. We are always pressed for time. There is never enough time. Yes or yes?
Yes.
Yes. And when I was talking about elegantly enrolling your patients in treatment, how many of you thought this is supposed to happen in the last 5 minutes of my appointment? Yes? Right? When does your doctor come in for their exam? Last 10 minutes, if you're lucky. Typically, it's the last 5. You're sweating because your next one's here and you know you still have to flip your room, right? So let's talk about how we can incorporate this into our appointment, okay? The 20-20-20 rule. How many of you have heard of this? How many of you are using this? Yes? In theory. So those 7 steps I gave you of the assessment are supposed to happen in your first 20 minutes, right? You see that up there? Okay, I'm going to blow your mind. The next 20 minutes, that is for instrumentation. Are you worried? Are you already sweating a little bit? 20 minutes to scale, holy cow. Why would it take you longer than 20 minutes? Oh, say it louder.
You're doing more than a prophy if you need a scale longer than that.
Yeah. Or maybe they're not on the right recare. Maybe they're coming every 6 months and they actually should be every 4 months. Maybe they're a prophy patient that needs to come every 3 months. We all know that patient that you're like, how do you build this much calculus and you don't have periodontal disease? They're just constant gingivitis, right? So by doing that assessment in the beginning, it gives you a lot of information to have a beautiful, well thought out conversation during that 20 minutes of scaling, okay? You're taking all that information you got from your patient and you're talking to them about why they need to come in more often, about why you're not going to be able to clean their entire mouth in 20 minutes, all right? During this hand instrumentation portion, I go back to their health history. This is where I really start to bring the mouth back to the body. This is where I'm talking about bacteria and bleeding and my concerns and how this is going to affect the rest of their body. If I have a diabetic patient in my chair, I'm hitting that hard, okay? Because it goes both ways. If you have poor oral health, your diabetes is going to be uncontrolled. If your diabetes is uncontrolled, you better believe you're going to be having bleeding, you're going to be having an open wound in the mouth, right? Yeah. And then those last 20 minutes, that's for your oral hygiene instruction. Adjunct services, this is where we're going to do our fluoride. Maybe this is where we incorporate some laser. This is where you are pre-appointing with value. Do you know what it means to do it with value? What's the distinction between me saying, okay, Julia, I'm going to schedule your 6-month appointment. I have a week in March. It looks like I have Tuesday, Wednesday, Thursday available. What would you like? Or, okay, Julia, it looks like Thursdays at 4 o'clock work best for you. 6 months from now in March, I have an appointment at 4 o'clock on this Thursday. I'm going to go ahead and put you in there. It's with me. Patients don't cancel on people. Patients don't cancel on their friends. You need to connect them to that. So that's pre-appointing with value rather than I'm just going to schedule your next prophy. I'm just going to schedule your next cleaning. It's just a cleaning. You can come in whenever you want. Okay. Chris is having a heart attack back there. I just hit her hard. It is not just a cleaning. You are not just a mouth maid. You are an oral health care professional. You're a prevention specialist. If they're not in perio, you are their prevention specialist. Believe that and own it, because you are. Okay? So, typically, that's when our doctor exam happens, right? That's 5 minutes, 10 minutes if you're lucky. I used to get so excited when it was like 15 minutes. Where would you like it to be? When?
At the beginning after radiographs.
After the first 20? Yes. If they can come in after the first 20 minutes, you have those 7 steps done, right? That's the goal. So if they come in at that time, even if I am just about to clean their teeth, you better believe if Dr. B walks in, I am up out of that chair and he is going to do that exam. Right? Because if he has treatment that we go over with the patient, the next 40 minutes, I have the opportunity to really enroll that patient. I have the opportunity to answer any and all questions. I have the opportunity to break down any obstacle they throw up, like, well, I'm going on vacation. Well, you shared with me that you want to keep your teeth for the rest of your life, and I'm highly concerned that this tooth is going to break. Then you won't have that tooth for the rest of your life. Put them in pain. It's okay to put them in pain. It's okay to put them in pain in order to get them the care they need and deserve. Yes?
On the vacation one, I like to say, geez, I really want to see that break on your trip.
Yep. And you know that's when it's going to break. It almost always does. Yes. Let's do it before you go. Absolutely. 100%. It's going to ruin their vacation. I mean, let's be honest. Who wants to go to the dentist on their vacation? I mean, we do, obviously, because we love this profession. But for a lot of patients, it's really scary to see somebody new. So be thinking about these things. These are the things that you can do for your patient in order to get them the care they need and deserve. In order to be the rock star. Yes?
So, in real life,
You want to role play real life?
well, I guess my challenges are
Yes.
that there's patients who won't come, at least not, I haven't been able to engage them to come more than twice a year.
Okay.
We all know why, insurance. So then I can't get everything, that 20 minutes.
Mm-hmm.
I'm not going to meet their needs that they think I should meet.
Mm-hmm.
As far as what they look like, and then the other challenge is I find, is there a way when a doctor wants to have a longer conversation because they see multiple issues that we could I'll try to eloquently say, how about if we get them back for a longer conversation?
Yes.
Because the conversation can take up my whole instrumentation time, or they come in the last 5 minutes and then I've got a patient waiting and I still have chart notes and make pre-appointment.
Mm-hmm.
So, I mean, this is the perfect.
This is this is the goal,
the
right?
goal. And so, do you have any suggestions what do you say to a patient that's coming every 6 months? They're not going to come more often.
Mm-hmm.
And you can't get it as clean as you want to,
Yeah.
or what do you say when all of a sudden the doctor's taking that time and you're like, oh my gosh, I've got 18 minutes, 15 minutes.
And you're watching it take down and you're sweating.
Yeah,
Yes, and yes.
And I so value what the doctor's doing.
Mm-hmm. Yeah.
And I value that the patient has questions, and then how do I eloquently interrupt or go behind him with like,
Let's talk some tips.
So tips.
So, yeah, I'm not allowed to touch that. Let's talk. Let's talk about a few things, because you touched on a couple things, right? You touched on those patients who don't want to come more than twice a year, and their obstacle that they're throwing up is insurance. And then you also touched on how long that exam should be, right? So let's start with the exam, because we were talking about that. Your doctor really should only be in your room for 5 minutes max. Okay? Now, we gave you these 7 steps for a reason. When that doctor comes in, it's okay for them to do a little chit chat. Hi, how are you? How's the family? And then there needs to be catchphrase, a keyword, some sort of, okay, he or she has had their personal time, and then they look to you and you deliver those 7 steps, what you found, right? So for some of my teams, I do tell them to put in like a catchphrase. It could be as simple as, okay, doctor, you get 2 minutes, or you get 1 minute to say, hi, how's the family? How was that fishing trip? And then I need you to turn to me and say, let's talk teeth, or what do we have today, or what's happening, something like that. Now, Chris has a beautiful tip. If your doctor is talking way too much, and get this as an agreement beforehand, right? They may be sitting there with gloves and a mask on. They may not be. Find out whatever you want to use. But take a mask, take a pair of gloves, hand it to your doctor over the patient. So, Kelly's my patient, you're my doctor, you're chatting way too much, I've had enough, I'm watching my time tick down, I'm going to take something and I'm going to hand it to you over the patient. That is your doctor's cue that they got to wrap it up because you got stuff to say. Okay? They may be, Chris has done this where they're sitting there all gloved up and mask ready to go, and you're handing them another mask. They'll get it. Get the agreement beforehand so that they know you are doing this beautiful assessment and you're going to deliver that to them, so they don't need to do a lot of talking. You're going to give them the information they need, okay?
What if they wanted to have a topic and have another mask?
Yeah, I just hold that box and just keep throwing them down. I don't know if you guys have picked up on this. I'm pretty bold. So for me, I direct my doctors. And I have fully interrupted conversations, not in a rude way, but I'll say, you know, it sounds like we have a lot to talk about. Should we bring Kelly back? I did mention that a consult might be best. No, I don't want to see him for a consult. Okay. So these are things that need to be discussed either in a morning huddle if it's happening a lot, or at a team meeting, so that you can get an agreement around how are we going to be more efficient and more effective. Some doctors like the mask trick. I just had a doctor who he got his catchphrase. It was, you know, let's talk teeth, or what do you have for me today? So that the patient doesn't pick up on that kind of stuff. They just think that's how we are. But I highly encourage doctors to do a 5-minute exam, especially if you are doing those 7 steps. Okay? You can literally just take those 7 steps and repeat them back, right? You can say what's most important to my patient, no updates on their health history, they're still taking the same medications. You can run through those medications and just tick each one of those boxes. And the more often you do that, the easier it is for you to tell the story and they can listen. Yeah. So that's one way of doing it efficiently. I have 2 hands up, and then we're going to come back to the other part of the question, which I totally just blanked on, but we will get back to.
We have this problem a lot in our office.
Okay.
Because we have, well, a lot of my patients are so like conditioned to like our doctors walk in and they like get out of the chair and it's like this huge thing.
Do they hug?
Yeah, and like
Okay.
it just depends on the patient. But one thing that we've done too, because our doctors are so chatty and we're still working on this because it still drives us nuts, is after we go through those 7 steps, like our tray charts, our tray covers our paper, we like have a dirty pen and we write everything down. So like if there's a lesion they need to check, if there's anything, it's on the tray. So if they sit down and grab their gloves and they're talking too much that we can't get a word in, at least they can look down and know that we want them to check 21 buckle or whatever it is.
Yeah.
So if we, God forbid, we can't like relay everything, at least we've done some of the work for them.
Yeah.
But do you have any tips for like also when your patients are like that? Like how do you recondition the patients to be like, no, sit down? He's like,
That's
fine.
I know, right? Seatbelt. That's a harder one. They're getting up and they're hugging the doctor? Or what is what's the get up?
Some patients will be like, oh, I need to give you a hug, and then they'll settle back down. Or I have patients that, they'll be laying down and the doctor comes in and they just sit up and they're like, okay. And he's like, no, I need to look at your mouth, like lay back down. And then it takes 3 minutes to get them like resettled. And you're like, why are you doing this? But our doctors have set this precedence and like, so I don't know. It's just, our patients are very disciplined, I guess. I don't know.
You can start retraining them. It could be as simple as a touch on the shoulder and one sentence. Like, Dr. B was my doctor, that's why I keep saying Dr. B. Touch my shoulder. Dr. B is going to be coming in. Please don't get up. We're going to do your exam. It's a gentle reminder. This will most likely keep them down. It's not a lot of pressure. This is an okay place to touch. We're in that. It's important to call that out. This is where you want to touch her, like here. But that would be a way to retrain them. Dr. B's coming in. He's going to do your exam. Please stay in the chair. It's weird that we have to say those things, but it's true. I want to get back to the insurance, and then yes, and then I want to come back to talking about them coming twice a year and verbiage that we can use on that.
So having worked with a lot of hygienists over a long period of time, I would say
And
that, we have to be directed. We do.
Yes. Thank you.
Okay?
Thank you, Dr. Hodge.
We do have to be directed, and I found the best way was sticky notes. If you got a patient's laying here and you've got a cabinet back here, put a sticky note. Kathy's chatty today. Be brief. Or it could be something like, Mrs. Jones has a lot of questions, suggest reappoint for exam. Right? That kind of stuff. Maybe she just visited her sister in the East, and her sister just had veneers done, so now she's got 8,000 questions, right? Not a good time during your visit. So the sticky notes you can direct them to obvious decay, or sometimes, buccal caries or lingual caries along the roots, or, just under the tissue. Sometimes they're on an exam on a patient, a little harder to find. You might clue us to that. Already discussed, showed her picture, already discussed doing a crown on number 20. I mean, you make your sticky note brief. You don't want to write a book. But let them get it. Or if they're running too long, put a note in your hand and go like this behind the patient. Shut up. Right? Enough. But, we don't mind being told kind of where to go. Right?
Truthfully,
Especially if you know it's going to be a big job. Yeah.
Because you've probably got two patients in the chair. So you don't want to spend a lot of time, even though Kathy wants to tell you everything that has happened in the last 6 months. We need to keep moving.
It's not always a patient. I love it. The doctors have wonderful information to impart. Doctors have a lot of information to share with the patient.
And even though I could probably share the same information, or
So I
they
think-
could direct me to.
Yes, I think that's a great point to call out. What we talked about, tip about the co-discovery process, being in that relationship with our doctors, it's a handoff of trust from them, right? So it's not that I want to kick them out of my room. They have a ton of value, and they have knowledge that we just don't have. But we want to make it efficient and effective. This can also go to a lot bigger of a conversation about matching and mirroring, looking at what your patient's learning style is, so that you can get into rapport very quickly and find out from your patient if they need a lot of details or if they're a big picture person, right? So we could go really deep on this one. I do want to talk about verbiage for your patients who only want to come in every 6 months. who, despite you doing a beautiful job of all the assessments, they just say no. It is their disease. And if they choose not to come in more often at your recommendation because that's what's best for them, it is still their disease. I will do to the best of my ability in that 20 minutes, but I'm not going to address their perio. If they are truly in gingivitis, I'm doing a prophy like a healthy patient deserves, because a healthy patient comes every 6 months. I'm going to document, and I'm going to have the conversation every time with my patient. Julia, I highly recommend that you come in every 4 months. I've told you that the amount of bacteria in your mouth, you're just not an every 6 month prophy person. I really would like you to come in every 4 months. Nope, I'm only doing what insurance covers. Okay, just so you know, your insurance does not have your best interest at heart. Does everybody know why we do twice a year? Toothpaste commercial back in the 50s, 40s. Fun side note, I was in Safeway yesterday. The toothpaste still exists. Yes. I took a picture. So, okay, I know only a hygienist is standing there in the toothpaste aisle with her camera out thinking that this is hilarious, sending it to all of her friends. So think about that. If it was a toothpaste commercial in the 40s that dictated this, and our insurance companies took that, and it's still the standard of care today. Share that with your patients. We have made huge leaps in medical, have we not? Huge. I would not want to be treated like people were treated back in the 40s. We know so much more now. Why is dentistry different? You're an oral healthcare professional. So it's hard, especially as a hygienist. We got into this. We're very caring, but our patients need to own their disease, and I am not going to kill myself for their choice. And ultimately, it is their choice. So if they want to come every 6 months, I'm not going to shame them for it, but I am going to discuss with them my concerns each time. And I get to like I said, I'm pretty bold. I'm pretty bold. I get to the point with them where I'm like, you know you need to come every 4 months. What are we doing here? Like, you know what's going on. You know you see the bleeding. Obviously, that's after I'm in rapport with them and they know how sassy I am.
Back to, I'm an older hygienist, and I was kind of trained to clean.
Yes, and we
Teeth.
still are.
And
It's
when
hard.
it comes to like a prophy, you kind of feel guilty leaving that.
Leaving something behind.
Mm-hmm.
Yeah.
So.
But is it your fault it's there?
No, it's not. But I still feel like I have something behind, and I should clean it.
Yeah. Yeah. It's a shift in thinking, and they do need to own their disease. Because when you go to your doctor's office, they don't say, "Oh, we're going to throw in this blood test for free," or "Oh, we're just going to throw in that MRI for free. I'm just going to do a little extra for you today." So it really goes back to that systemic link for your patient and understanding that this is a disease that's happening in their mouth. But I totally understand it is hard. It is hard. But if we don't talk about it with them, they're never going to own it. And you're going to be stuck in that cycle. And then, my body hurts. It's because we're killing ourselves for their disease. Yes.
What about patients who, I have two in particular.
Yes. Let's get into the nitty gritty.
The ones you see on your schedule and you're like, oh, why? That you have talked until you are blue in the face. It is very documented. And you get to the point where, but you're still talking to them, right? Because I have to, and I want to.
Yeah.
I want them to fix it. And they get angry. And then, the doctor comes in, and the doctor has already been through this numerous times to the doctor, and it's not someone that gets cavities. So their teeth always look fine, but everything else is a mess. They're loose. And I'll keep talking after the doctor does the exam, try to get them to come in more frequently, SRP, the whole 9 yards. And they go, well, the doctor said I look fine. I'm Like, we're talking about two different things, but then they just get angry. I mean, at what point do you just go, I don't care?
Two things.
Or
First,
what do you do?
let's make a quality request of our doctor that they don't say, you look fine. That happens all the time. All the time. Everything looks fine because for them, they looked at your teeth and your teeth look fine. They trust you to deal with the soft tissue, with the gum tissue. So there's that. And then the other part, when we're asking our patients what's most important to them, how are we linking their perio health to that? So you don't want to shame them. You always want to come from a place of, I just care about you. And so I want this for you. And I know that it's not something you want to do right now. But I would be remiss to not talk about it. When this patient comes back in, really make a point to have a great conversation around what's most important to them. Okay? Yes, Chris.
The other thing to do is to do a sit them up, swing it around, and do a knee to knee, and go. You always get that agreement with the doctor beforehand that you're going to say to them, we have two options. We can treat this disease that you have, or I can refer you to a periodontist. Which would you like to do? Because keeping them under your roof where they're constantly saying no is not helping anybody.
Yeah.
A new patient, totally different story. You haven't built rapport. You know, there's things going on there. They may not have a lot of trust, and you have to build that. But a patient that's been long-term, I don't want to say they're playing you, but they are playing you. They don't believe they have a disease.
Yeah.
And nothing hurts, right? So it becomes an agreement with the doctor. Dr. Mangrum, is it okay if I talk to John today? He's been refusing perio for the last 3 years. I would like to have the conversation. We need to treat this here, or we need to refer to a periodontist. And 9 times out of 10, my doctor just says, go ahead. And he'll come in and support me, because then the patient goes, I want to see the doctor.
Mm-hmm.
So that's why you have to have that
They're trying to go over your
pre-conversation.
head. What else? Yes.
This won't work all the time, but sometimes you can agree to have some sort of agreement that, so Mrs. Jones, if we get together in 6 months and we're finding out that you've gone downhill more, could we agree to go ahead with a periodontal therapy?
Mm-hmm.
That will work
Yeah.
with some. Yeah. Another might be to reframe the question somehow, ask it differently. Would it be okay with you if you lost a couple of teeth? Would it be okay with you if you lost a couple of front teeth? Right?
Mm-hmm.
That may reframe things. I also like because of the fact that you told me that your parents both have dentures and you didn't want them, because of the fact that you told me you lost a tooth already and you don't want to lose any more, because of the fact that you said this, and this, that's linking it back to what they already told you was important to them, I would really strongly suggest this. Science tells us, that gum disease is often episodic, doesn't go the same all the time. And just like losing dirt around a fence post, right? You're losing dirt, right?
That's a good visual, right? You're losing
Right?
dirt.
What happens to a fence that has the fence posts all like loose? It falls over pretty soon, right?
Mm-hmm.
The other thing is that people hate when their front teeth all of a sudden start overlapping, or one becomes longer than the other, or their whole bite is shifted and their teeth are coming forward and they're separating. People hate that.
Mm-hmm.
But when it gets to that point, it's probably too late.
Definitely.
Yes, I know it doesn't hurt.
Yeah.
It doesn't hurt the day before you have a heart attack. It doesn't hurt the day before you have a stroke.
Yeah. Amen.
Right? Just launch into that again. It won't work all the time, but it might be helpful sometimes.
Yeah.
Okay?
But it is another approach. And I love the doctor. those of you who are newer hygienists and are maybe coming behind a long-standing hygienist and you're having to have perio conversations, that is a great way to bring it up. We don't know when it's going to flare up. There's a lot of stuff that happens in that 6 months in between me seeing you today and me seeing you in 6 months. I don't know what's going to happen in there. Okay? When that hygienist saw you previously, she may not have he may have not seen a flare up. And today I'm seeing this flare up. Okay? Linking it back to systemic, linking it back to what goes on in the 6 months you don't see them or the 3 months you don't see them. A lot happens in that time. And so you want to do everything you can while they're in your chair to prevent disease before the next time you see them. Okay?
Just along the same lines, not episodic. Sometimes when you say that, they'll look at you like you're from Mars. Right? To give you the look, the rolling eyes, whatever it is, all right? Ask them this. Do you always have a cold? Do you always have the flu? Why do you get it sometimes but you don't have it other times? Just, link it to something that they can sort of think or they can identify with. Oh, yeah, I don't.
Dr. Hodges, Chris, Kelly, can we come up to the front?
So thank you guys so much. We are going to do an expert panel for you since we're all here and we just have a lot of knowledge between us all. So some of your questions you were asking were really great. We want to know what other questions you have. And because we have these fabulous fortune coaches up here, they can answer a lot of other questions as well. If you want to ask more about matching and mirroring, if you want to ask more about transformational vocabulary, more about learning modalities.
Any questions? So there was one, are we live here? Okay. So there was some interaction where we did our exercise and a couple things came out that I shared over here when we were talking, and I wanted to acknowledge Dr. Hodges for being very powerful with questions. Very powerful with questions. The relationship that we're looking for with our patient is to be in a coaching, a health coach, a health advocate relationship versus a teacher-pupil. Does that make sense? It feels better to be a coach than someone lecturing someone. Has anyone ever heard that? I don't want to really go in. They're just gonna tell me that I haven't flossed or I'm doing a bad job, right? Okay, so one of the ways to be a great coach is to have leading questions, right? And what you heard this evening quite a few times was really powerful questions from Dr. Hodges. So I just wanted to highlight that and highlight that coaching relationship that you're all seeking for. And just like we seek for a coaching relationship when we're passing this information on, we want to be able to convey it, but it's not in a way to tell. It's about a matter of asking some good questions and then saying, have you ever thought about, that's a great just have you ever thought about. So if I'm hearing you correctly, you're concerned about this is another way where you restate. Is that what you're saying? So you're saying you really want to keep your teeth? Yes. So part of the conversation is getting them to say yes. Getting them in a conversation where they're now saying that. Dr. Hodges had pointed out earlier when there was a image on the screen that said, and it was during our conversation over here, where it was, what do you see? Perfect. Get them talking. Are you concerned about this? Because I'm concerned. Are you concerned? Because I'm concerned. The other one and this is one that you want to get your pen out for. This is something that I know the hygienists in the room that work with me know this one. There's one great question that I'm saying all the time. So what's your plan? What's your plan? What are you going to be doing? That is the closing question, right?
Talking about being the solution.
Yes.
And getting the commitment.
So what's your plan? You know what? I'm here. I'm the coach. I'm here to help you. What is your plan? How can we serve? How can we support you? But without knowing the plan, we don't know which direction to head, right? So their plan could be, I'm just going to get through the wedding of my daughter's wedding next month, and then I'm going to go ahead and schedule that. Great. I'm so happy to hear. This is like Chris was saying, thank goodness. I know we've been talking about this, right? Great. You know what? So that we stay on track for that plan, let's get it scheduled. Because now you're calling a bluff. Right? Let's put it on the line. If your plan is next month, if your plan is 6 months from now, if your plan is 9 months from now, let's put it on the schedule. You can always move it out, but let's put it on the schedule. So that's a couple tips I wanted to pass along, and I wanted to acknowledge the great questions you can tell from the coaching. When you are a health advocate, you act and you ask great questions like Dr. Hodges did tonight.
I observe, so when Julia and I coach hygiene teams, we observe a lot. We're in the offices, chair side with a clipboard and a pen, just like hygiene school. And we're listening to you. We don't ever interrupt you. We never walk in your room. We never do anything like that. It gets a little unnerving for the hygienist for about the first 15 minutes, and then they forget we're there because literally you don't see us, you don't hear us, nothing. However, one of the questions that I would love for you to reconsider is, how often do you floss? When we say that, we are making them wrong unless they say, I floss every day, which they don't. Nobody does. Okay? So what answer do I normally get? And see if this rings true with you. Not as often as I should. Right? So that's that blanket statement saying, when I eat corn on the cob, I floss. And so we really want to avoid making our patients wrong. When people feel wrong or people feel inadequate, they don't want to come to see you. Took me a long time to come up with this question, but I usually will say to them, I'll say, tell me what you do when you're at home. Tell me what you do for your home care. Tell me what you do. Tell me more. So that gives them the opportunity to say, well, I use an electric brush in the morning, and sometimes I brush at night, and sometimes I don't, because they're not wrong, right? I'm just saying, tell me what you do. And so I can help support you. Do you have a water pick? Is that something you would like to consider? Things like that. So if we can just say, how often are you flossing or brushing? It's like, it's the last question. It's the question they do not want to hear. So just reconsider that. And then just to reiterate what Yolanda was saying, when we were listening to the groups, and it was super cute because once I mentioned it, you ladies and gentlemen started catching yourselves, is watch your language. We use minimizing language to make people feel better. Okay, we don't want to give them the bad news, so we start saying little, some, kinda, just a little cavity. Yeah. I had a doctor, honest to God, 2 days ago, listening to him, little tiny. He didn't even say little tiny. You have a little tiny cavity. We just have to do a little tiny filling. It will only take a little while. I'm like, every time he said it, the lady went up front, and Chelsea presented to her filling, one surface filling, right? $104 copay. And so the lady said to her, what does a real filling cost? It's exactly what she said. So please be careful when you say a little bleeding, because that little bleeding for that periodontal therapy, that's going to be a $200 or $300 copay, is all of a sudden, whoa. So please, it's their disease. They need to own it. Just drop those minimizing words. Okay? Yes.
Touching on what you were saying about Jonas about flossing, and whatnot is and tell me if this is a good technique, but some of it what that's one question we use is like, tell me what you're doing at home. And like, we'll write down our notes what we're doing. And then we write down what we said. So the next time I see them, I can be like, so did you get that water pick? How are you liking it? Or like, is that okay? And then if they're like, oh, I didn't get it, or I bought it, I didn't take it out of the box, I can be like, okay, well, you got it. That's step one. So now or yeah, I'm using it. Okay, great. Can't wait to see how much things improved. Like, is that kind of, or like just leading with, okay, this is where we left off last time, and then leaving it open-ended. Is that effective? Or
I think it's great. I'd ask the same question first. So the second time around, what are you doing at home? And if they don't even mention it, you're going to be like, I remember us talking about a water pick. What happened? That's it. Just what happened? Oh, I didn't get it. Oh, I have one. I didn't open it. Oh, it's super messy. I get that. Yeah. Okay. It's so messy. I used it twice and it washed down my whole bathroom. So I start, then it's open for me as, would you like me to give you some tips on how to use that? Oh, that'd be great. Yeah. Okay. So I can help them. Yes. And like I said, we just don't want to make them wrong. They already don't want to be there. They're looking for a reason not to come. Okay. So.
How many of you guys work in offices where you have other hygienists who are not here? Everyone. Yeah, pretty much everyone. Dr. Mangram's office is all here. I would encourage you to go back and sit with your other hygienists and just make copies of what we gave out tonight.
Yes.
And share with them what you learned tonight. And it's a good opportunity if you have a patient cancellation, which I know we don't have many of, but if in case you do, go to each other's rooms and listen to each other. And talk about, we did a great job role-playing tonight, but when you actually are sitting in the chair and you're listening to each other, there's a lot you can learn, and you can also make sure that you're on the same page. And when patients see that, it's very powerful. So I work in an office with 2 other hygienists, and often patients don't get to see me. They get to see Sigrid, or they get to see Tina. When Sigrid and Tina tell them the same things in the same way that I tell them, they're very impressed by that. You guys are a team, you're tight, you really have my best care in your heart, in your mind. So that's really powerful.
Could you give any suggestions for the health history? I'll have patients come in and all of a sudden they've got a piece of paper here, a piece of paper there, new meds. Well, I think it's this. I'm not sure. Well, I had a guy come in today. Well, something with my heart. Wasn't sure. It sounded like AFib because of what they put him on. But I don't have to take it all the time. Only when So what do you do to make that more efficient? Do you have a specific program you use? How can we make it really efficient? Because they'll be laying in, I'll ask the whole questions and all that, and then all of a sudden they're laying in the chair. Oh yeah, when I was in the hospital last week, I didn't brush because I had a heart attack. Well, I didn't think it had anything to do with what we're doing today, even though we have the list. So if you have any suggestions, because that can eat up my time too, because I'm like, oh my gosh, we got it.
So let's
I
see.
know.
So who wants to take this one?
I will take it. Why don't we just? I don't need the mic. But we could just go down the line. I'm sure all with tips. Something that Chris and I teach is you want to ask them what changes have you had. If they say no, hit the 4. Medications, read what you have. Surgeries, allergies, hospitalizations. Since the last time I saw you 6 months ago. Since the last time I saw you 3 months ago. That will hopefully jog their memory, and there will always be someone that does that to you.
There will.
And
No,
they'll
there will.
probably do it in front of your doctor.
Yeah.
When you're like,
The big one is the list of medications because it's so funny. Oh, no changes. Oh, no changes. Oh, no changes. Okay, I have you on aspirin, HCT. Oh, no, I'm not taking that anymore. Oh, no, I'm not taking HCTZ. I'm taking blah, 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 blah. And you're like, okay. Yeah, no changes in your medication. Yeah. Okay. The other thing is you will always have that person. I had the one man, did the whole thing. I was so good, did it so right. Doctor comes in and goes, hey, John, how's the golf game? Oh, dude, I haven't golfed this year. Hip replacement in July. I'm like, and I'm just standing with my doctor going, I asked. Because the first thing he does is look at me, right? And I'm like, I asked. I don't know what more else to do. Have him drop so I can see the scar? I don't know. I asked him. So there is always going to be that person. But hit the meds, hit the list, and the four big ones. And
read
yes,
the medications
read
to
them.
because that will also open that conversation up very quickly. It really starts to jog their memory.
Right. Oh, I started every once in a while I get somebody, read the meds, everything's fine. Oh, I started insulin injections. That would be a medication. So you don't want to be sarcastic. We say, oh, thank you so much for telling me that. Okay, so I know. Everybody's laughing because we've all had it.
Yes.
We've all had it because they don't think their mouth is what? Attached to their body. So we do.
We act on that.
Yeah.
Because it's difficult because being in our profession, and
Like medical care, medical insurance, and all that, it's so much more proactive in a sense. Where we're fighting so many different things. Everything everybody thinks about oral care, that we're changing, and if we so we're kind of like the forefront of that, really.
Yes.
So you've taught me a lot tonight. Thank you.
Excellent. Did you have?
I'm going to say one more thing while you're
Always have things to say.
You're a mic guy.
Not really. This is a subject that's
Not
like
really.
near and dear to my heart, and you have to also understand that I'm married to a hygienist. So, I've been hearing this stuff for a really long time. And first of all, I want to acknowledge these ladies for being here tonight and for putting on this program because they don't happen often. I really want to acknowledge tomorrow's program because that laser certification doesn't come around really. And if you live where I live, it doesn't come around. And also to acknowledge Yolanda for having this amazing classroom here with all the cameras and the screens that's a lot of foresight, a lot of expense, a lot of headaches, a lot of decisions. It was a lot of stuff, I've been here a few times now, and every time I come, I'm impressed. And thank you all for being here tonight. I want to get back to the power questions, the WMIs a little bit. So, how many of you feel like that might be a little bit uncomfortable for you? Raise your hand. Yeah? Okay. Here's another question you might try. What burning questions do you have that you'd like for us to answer today? Right? That's a pretty easy one. Mary, I know that a lot of people look at stuff on the internet, they see television commercials, they see all kinds of stuff. And I know you've been coming here, and I've seen you every 6 months for 5 years, but I want to check back in with you. I want to make sure that we're treating you absolutely as best we can and that we're meeting your needs. Do you have any questions for me today? Something along those lines that tells you, we care, you should trust us, right? We can help you. Those are 3 questions, especially new patients, right? Do these people care? Can I trust you, right? Can you help me? So you want to kind of answer those questions, but the idea of opening the questions, and so, sometimes it's hard to get started on these things. Look at your schedule next week and say, who could I start with first? Who's easy, right? And just start it. Just start it. Or if you look at the schedule, you're at the morning huddle, not everybody needs the same amount of energy in a day, right? Who needs more? Who can we serve better? And then start that conversation, right? I just want to make sure that we're serving you absolutely as best we can. And I'm wondering if you have any questions for us today. Have you seen anything new? It's just, you know what I'm saying? Just
For me, everything is new because I moved from Connecticut. So in Connecticut, the meetings are a little different than here, and I like this kind of interaction between instructors and not students, but the audience. So thank you very much for your effort. It's wonderful.
You're very welcome. We've all had to start someplace. We're all seasoned vets here. We've all been there. We've had uncomfortable times, way back when, right?
Never.
For sure. Or there's times that somebody left and you're thinking, geez, I wish I hadn't said that. Or I wish I had said, right? They touched on a really good one about, if you start asking people about, do you floss, do you this, do you that? I hear that all the time in offices when I'm there. Better question for me is just, what do you do to care for your teeth? And then shut up, right? Sometimes when you say, what do you do at home? I don't necessarily like that because I can't tell you how many times I've been sitting in traffic watching somebody pick their teeth or floss their teeth or putting on their eye makeup or, whatever it is. So I just, what do you care for how do you care for your teeth? And they'll maybe tell you stuff you never thought of, right? So, and then sometimes if you want to help them make things easier for them, if they have their toothbrush there and they tell you they can't floss, tell them to put some floss right next to the toothbrush and just start by flossing 2 teeth. See how long it takes for them to add a couple more and to add a couple of more, and maybe they get to the point where they can't stand not to.
Question?
I didn't really have a question, but I usually like to say, like, what do you use to clean in between your teeth? That's what I like to say.
That's great.
Yeah. So
Yeah.
sometimes they're like, but then sometimes they're like, oh yeah, I use floss. I'm like, oh, floss picks or string floss.
Yeah.
Like, what do you like to use? So that's what I like to.
It is, yeah. Because it's not shaming them, you're not telling them, and you're giving them the opportunity to talk to you about what works for them. Because, like we said, we got out of hygiene school thinking we were going to save the world with floss, yes? And so many people have such a mental block against floss. So why are we dying on a hill for them to floss? Let's talk about what's going to work for them. Let's really customize their care. So that's a beautiful question to talk about, how to customize care.
Any other questions or comments?
You're getting a workout. Stretch it out.
So I have a difficulty to approach the patients who's like highly educated. So this last 2 weeks I had a patients like medical doctors. So they both had a kind of same situations, but different kind of approach. So I work in 2 different offices. So one was the medical doctor as a new patient came in and hadn't been to the dental office like any treatment done for 3 years, and then had left side 12 millimeter pockets and pus discharge. He denied the x-rays. We took the intraoral picture and we just said that, like, what we can see just like visually. And then, so he said he is aware of it and he said, I'll think about it. And he said he will make an appointment for x-rays and treatment, but he left without anything.
Without an appointment.
He just had the teeth cleaning. He didn't want anything else. So the other was, sorry.
Yeah.
The other one,
Yolanda's itching. She is so ready.
So he was like, he said that, oh, I'm aware of it now, so I will think about it. And the other condition, same medical doctors. He's been coming for 4-month cleaning. He had the same situation, but in the different side. It's a different doctor.
Oh, man.
10 millimeter pockets.
Are they hanging out? Hanging out and making out? Yeah.
It's a different office.
We passed bacteria. We all
10
know.
millimeter pocket, pus coming out. And then when I was like getting into like, he said he has never flossed his teeth for 20 years. Nothing gonna happen. I'm getting old. Everything's gonna fall out. And then also the interesting was I had never patient denied flossing. He denied flossing.
Oh, like you polished and then he was like, please don't floss my teeth.
Yes, I have never had patient. I've been hygiene for 4 years, or school 6 years. And then I was like, well, because he had a like kind of moderate to heavy buildup on the lower anterior, and I always check floss at the end just to get it like, And then he was like, I have to floss at least your front teeth so I can make sure there's all the tartar come up. He was like, okay. So that's the only area. But I don't know what happened, but he was willing to stay. He was not due for x-rays. He was willing to stay for the x-rays. He, since I was kind of behind the schedule, he was in the different room. It was my last patient for the day. So doctor took it for the x-rays, and then I don't know what's the prognosis. I left the office. I just work 1 day a week there. So I'm going to follow up for next week. It was my this week, this Tuesday patient. So I'm kind of like, I was trying to get into the flossing, but he was just like laughing at me. And I was going to the point, like, that there's a correlation, heart and then mouth. And he just laughed at me.
So if
You wanna
I'm
take
having
that?
those
Go, Yolanda, go.
kind of patients, like
Yeah, yeah.
So we all know that doctors are an expert in certain areas, yes? And are you not an expert in the area? Yes.
it's just like
So-
trying to ignore and laugh at it, and it's
Yes.
just a little bit.
So,
Yeah.
and how many have
Difficult.
seen, even though they know about the smoking, right? They know they're around the corner smoking, heavyweight or whatever. I mean, person. Like you, just like the next person, it doesn't matter if they've gotten that degree or not. They know what they know, and they also want to ignore certain areas just like anyone else. So it really does come back to the power of questions. You have to get in a place where you have permission to coach, right? And so it starts in the very beginning when you want to introduce that conversation. Now, I understand because you're out 4 years now and you're feeling a little intimidated by someone like that's maybe been a physician for 20 years. We all should be continuing to learn all the time. And the truth be known, there's not anything, they don't know what they don't know, right? So you do know what they don't know. So you are the expert, even though this is not their area. One of the very best ways that I have found in our office is to go ahead and just kind of walk alongside them where they're at and just, wow. Yeah. So because when you get in that moment with them and you're just concerned and you're just going, wow, you have an infection here. And you can say, that you have pus, that this is a chronic infection. And I'm sure you do know how that is related to your oral health, is related to your total health. And I'm sure you are aware of the studies out there that link that. Now you're not tearing them down by saying that. I'm sure you're aware of that. And I'm sure that this is surprising to you. One way that we can go ahead and find out exactly which area of bacteria this is would be, I would be leading them towards getting some tests. Will respond really well when you get the absolute lab tests, like oral path test, the oral DNA test, because that's in their mindset. So when you can show them these specifics and you can show them more information, I'm sure you're as concerned as I am. So it goes back into getting that rapport. But you are the expert in this area. So own that, and now that you've had like 3 experiences, arm yourself to be ready, because there's going to be dozens more coming your way all the time. And so, but you do want to stay in rapport with them and not make them wrong, because they're probably going to start shooting off lingo that you're like going, what are those acronyms standing for? That's not my arena. Because you don't want to get into a defensive way. You just want to say, I'm sure you're concerned because part of your body has an infection in it. And I'm concerned too, so let's figure out why that's there. Let's do some lab work. I think that that's immediately a way to just get in there and figure out what's going on. Because they're going to respond, they're ordering labs all the time. And then you can get very specific with them and let's get you back. It's always about getting them one more step with you on that journey. Just that next appointment, and the next appointment, and the next appointment. You're not going to take them from, all the way down. Maybe you might not all the way get to root planing. Maybe you may not get them to a periodontist immediately. It's going to take some rapport, and that's going to take a process. So, did someone else have it?
No, that was, yeah.
Can I ask a question? So, if I could ask you a question, was this one isolated tooth, or were there other periodontal problems? One isolated tooth. So it is possible that there was a trauma history there, and that's the reason it's one tooth. But if a one tooth is abscessed and it continues, there's a good chance they're going to lose a tooth next to it, right?
Yeah, we couldn't find the abscess because the first one denied the X-rays, so it's just like visual and probing. The other one, I haven't followed up with it every day. So
Yeah.
we had X-rays, but
So I'll totally agree with everything that Yolanda just said, that they're experts in certain areas, they're not experts in other areas. If it doesn't hurt that bad, they think there's not a problem, right? You know, if it was more of a generalized problem, I'd, you know, maybe ask them, how many teeth are you willing to lose? Or if you lose enough bone here, there's no way we can place an implant.
yeah, I will say like the basic. There's a pus discharge. There's inflammation for sure. But if I keep talking, it feels like they want me to shut it down. That's the point. I was like, kind of feel discomfort, like uncomfortable to talk to them. But I think the lab part is the best. That's. Thank you.
Just go back to that. You don't want to be lecturing at them. That's a very important one, especially with someone who is an expert in, you know, healthcare, so in some other area of healthcare. You are definitely not going to want to get into a lecturing match with them. You don't want to tell them. You want to ask them really good questions. You want to get them thinking. These are smart people. Lead them to where you want them to go. Ask them another good question. You're right. It could be related to that. And you've had a heart attack recently. Well, I'm sure you're aware of the study. Yeah, I'm sure you are. So, yeah.
I'll piggyback while she's clicking the mic. We, as hygienists, very quickly slip into telling. And it is extremely important to remember those power questions and get them talking, because that will lead them where you want them to go.
I think sometimes we forget that people are people and they're not all the same, and we want to fix it. And we want to fix it now, and we want them to do it our way. But it's like anything else. You can have a person with heart disease and you tell them, don't eat fried food. They're going to eat fried food because that's just that person. And sometimes it takes time to get them to, you know, do what you tell them to do or want to do it. They got to want to do it. You can tell them till you're blue in the face. If it doesn't click in the brain, it's not going to happen. Just be lucky that patient's coming in every 4 months. I'm sorry to say it like that, but, you know, sometimes I'm just happy they come in every 4 months, and I just keep trying and trying. But they're people, you know, we're human beings, you know, and they react to you like a human being.
And that's really where asking what's most important to the patient, connecting it back to what's most important to them, and listening to what motivates your patient. Because that's going to help you as they're continuing to come in. You're peeling back that onion.
Yeah, and I think what Dr. Mangrum said about the vocab, when you're dealing with a medical doctor, you can be a little more, you know, she mentioned pus. You don't normally say pus to patients. Some you do, but like with a medical doctor saying you have an infection, there is pus in your mouth, is something that, like she said, they will relate much more to when you go more medical with them, and then stay where they're at. So I have a particular patient I'm thinking of. I'm like, okay, when I get him next time. Yeah. Who else? Well, I think that we have had a very impactful evening. What do you guys think? We're going to pass out some surveys right now, and we'd like to hear from you all very much so as to what you would like to learn about. I'm sure you all have some burning questions. You're like, how would you do this, or how does that work? Please write it down. Our education center is definitely always looking for also educators. So if you know someone who has been a mentor in your life, someone who's shed a lot of light on something and you think that they would be great for our facility, please let us know. And if you have any questions about hygiene mastery and the incredible impact that hygiene to hygiene connection can make in your office with coaching. Someone who has walked in those moccasins, right? Someone who is currently, yeah, those Crocs. Someone who is currently doing that dance, that understands exactly where you're coming from, and also has a connection with a national brand, a national company who is basically got resources. You know, tonight we all had a lot of yes, that happens here. Doesn't that feel good to know that you're not alone? Sometimes you feel like, I'm sure, I know I do, except for the way that I don't feel that way is to stay connected with other folks. So if we are connecting and your coach is connected with other practices, and you can find out that there are ways to do this simpler. And that's what the coaching does, is it connects you with other folks. Did we get both the survey and, so that everyone got a survey as well as a, yeah, go ahead. So there's a survey.
It's coming around. So I'm going to hand out two things. Your CE form will come as well. I think Wendy has those. One is a survey for the course that we'd like you to finish as you do every other CE. Let's do that. Go ahead. Okay. And the other is, if you would, we would love to hear from you and get a review. So if you're willing to write a review for us on here, we can publish it for you. You don't have to go online and do it, as long as you give us your permission to publish it. So we'll publish it exactly as you write it.
And for those that are in the audience, sitting at home, maybe in their pajamas, ready to go to sleep right now, with a glass of wine, you get to answer 15 questions, and they'll be in your email tomorrow, and then you'll receive your CE once you have also completed your survey. So I hope you guys all enjoyed tonight's presentation. You have a safe trip back, and you put all of these great tools into work, and go out there and change those lives.
Thank you. If anybody's interested in talking more about Hygiene Mastery or learning more about how we can support you in your practice.
Turned off. Oh, am I turned off?
Here you go. I'm okay to use this now. It's safe. If anybody is interested in learning about how Hygiene Mastery can support you in these 5 tips that you learned tonight and also so much more, please come talk to me. We're offering a department analysis at no investment for you. Okay? Thank you.
We'll be here after to answer questions in case you guys didn't want to just talk in front of everybody.
Love to chat. Just come say hi. We don't have to talk to them.
Yes. Yeah, there is 3 C's. Oh, it says 2 on their certificate instead of 3? It says 2 on their certificate instead of 3? Should I just initial them all?